Aquecimento hospitalar está de volta e eu quero saber, vocês estão gostando do conteúdo? Então, me conta aqui no chat, tá bom? Olha, a Renata Pasquarelli comentou aí no chat que ela estará presente na hospitalar desse ano. Então, Renata, quero te ver por lá. Aliás, quero ver todo mundo por lá, tá? Lembrando que é de 17 a 20 de maio. E agora eu convido novamente o Gastal aqui para anunciar o nosso próximo conteúdo.
A nossa atividade agora vai ser organizada, é uma entrevista que a Giovanni Lolato vai fazer com o CEO da ISQUA, o Dr. Carsten Engel, que ele é um dinamarquês que hoje trabalha na Irlanda, na sede da ISQUA, na Irlanda, e que tem assim uma intensa atividade internacional e essas conexões, inclusive pelo papel da ISQUA diretamente com a Organização Mundial da Saúde. Ele vai trazer uma visão abrangente da questão dos impactos da pandemia, das perspectivas futuras para o sistema de saúde a partir da queda dos indicadores de contaminação e de mortalidade, e com isso como que a gente vai, ou pelo menos na visão dele, como que o mundo caminha nessa direção da superação da pandemia e da reorganização dos sistemas. Então, eu gostaria de passar desde já a palavra para a Giovanni, que vai iniciar a entrevista, e daí para frente nós vamos ouvir a conversa desses dois colegas interagindo e discutindo aí as perspectivas e o futuro. Muito obrigado.
Hello everyone, I'm glad to be here today talking to a wonderful professional that has a lot of experience to share with us. I'm sure we will learn interesting and important things. Carsten Engel, it's an honor and a privilege. Thank you for accepting the invitation.
You're welcome. It's my pleasure and honor.
Thank you, Dr. Carsten. And today I have the pleasure to interview Carsten Engel, and we'll discuss about health in the post-pandemic world. I am Giovanni Lolato, specialist in patient safety and operational manager at ONA. I will present to you Dr. Engel. Carsten Engel, for you know a little with Carsten Engel, joined the International Society of Quality in Healthcare, ISQUA, as CEO May 1st, 2021. He has 17 years of experience in quality improvement, preceded by 19 years of clinical frontline service in clinical management. From 2006 to 2021, he worked with ISQUA, Danish Institute of Quality and Accreditation in Healthcare, since 2010 as Deputy Chief Executive. Here, he has been a leading member of the team that developed and implemented the Danish Healthcare Quality Program, a series of accreditation projects that by the end in 2021, we will performed over 6,000 accreditations, reaching all providers in almost all sectors of Danish healthcare. Dr. Engel obtained a Master of Science in Physics and Chemistry from University of Copenhagen, in 1977, and graduated as a physician in 1984. He holds specialist recognition as an anesthesiologist. And Dr. Engel has been member of ISQUA, IEEA Accreditation Council since 2010, Deputy Chair 2016 and 2021. He has been an ISQUA expert since 2013 and was appointed as member of ISQUA Academy 2019. He has contributed to the development of ISQUA International Accreditation Program and has been an IEEA surveyor since 2010 and until his appointment as ISQUA CEO. It's a pleasure you stay with us today, Dr. Engel. It's a great pleasure to have you participate with the Digital International Congress on Health Services. The central theme of the Congress this year is health in the post-pandemic world. Our idea is that you can share with us and the public that stay here about ISQUA perceives the future of health systems, quality and accreditation post-pandemic. What are the challenges that we will still face, as well as what strategies do you believe are valuable to this scenario? Before starting the interview, I would like a little brief with you, Dr. Carsten, comment about Brazil. Because in Brazil, we are living in this moment, a more controlled moment of pandemic, without many cases and without critical cases. Many organizations have already returned to work on site, or others have adapted and transformed the process with the intention of maintaining the format of online or hybrid work, either because of a reduction in costs or actually restructure your process, provide a better way performing the work. From this context, Dr. Angel, here my first question. If we look at the context of pandemic on the health system, quality and accreditation, what was the impact of it? What do you say about it, Dr. Carsten?
Well, first, congratulations on being on your way out of the pandemic. We are beginning to see the light at the end of a tunnel in many countries. We are not still there yet, but we can envision a post-pandemic world ahead of us. And what have we learned? What have we learned during the last years? First, let me say that both healthcare systems and individual healthcare staff worldwide have demonstrated an extraordinary capability to adapt and to innovate and to meet enormous unknown and unforeseen challenges. And this is a testimony to the dedication and the resilience that is within our system, and this is a good thing to have with us. But of course we face challenges, because what we hear many hospital managers say at the moment is that when we ask them, what is your greatest concern at the moment, then often we hear the answer, that's workforce. And why is that? Well, workforce has carried an enormous load during the last year. They have been at risk, they have been hardworking, and once the pandemic is over, they cannot look forward to a period of relaxation and recreation, because during the pandemic, an enormous backlog of treatment that was not able to be provided has accumulated. So the requirements, the expectations for what they should do and what they provide, they would be great in the upcoming years as well. So this is one thing that we need to be very high on our agenda. How do we take care of our workforce? Some of the things we have learned during the pandemic is the importance of logistics, both when it comes to supply chains. How do we manage to get all the equipment, all the drugs, all the vaccines to the points where they're needed, but also in terms of patient flow. And I must say that when I went to medical school, which is a number of years ago, we learned nothing about supply chains or patient flows. We treated, in our imagination, one patient at a time, and we assumed that supplies were always available without further needs for considerations. It is I guess the experience of any young doctor in his or her first appointment that that's not the way it works in real life, and it has been even more emphasized now during the pandemic. But we have also learned some things. For instance, the way in which vaccinations and testing was organized. All countries have been able to carry out huge numbers of tests and vaccinations. And how have they done it? They have done it by managing these chains and logistics prudently. In my country, for instance, often office buildings or factory buildings were taken into use for these purposes. They were manned with medical staff, doctors and physicians that had nothing else to worry about than giving the vaccinations or taking the tests there was a huge organization among them that allowed them to ensure that patients could book their times on the internet, supplies were available, and we could vaccinate an enormous number of people in a very short time. I'm sure you have had the same experience. And of course, there were some patients for which this model did not fit, people who were not available to book their appointments on the internet. And there were other systems to make care of them. GPs, for instance, could have a crucial role in this in this connection. So I think in the future we need to be more aware of the importance of managing flow than we have ever been, because another challenge ahead of us, which was there already before the pandemic, is that the demands grow like this and the resources grow like this. There's an increasing gap. There's no conceivable way we can close the gap by allotting a lot of more resources to healthcare than we do at the moment. So we will find ways to make more out of the money we have, the resources we have, the staff we have. And as some people like to say, sometimes we can't do this by working harder, we must do it by working smarter. And of course, there are limitations as to how much we can do, and I will come back to this a little bit later. Another experience we had is also that we have tended to create very lean processes all the way through our supply chains in our hospitals as well. We need to appreciate that to build resilience, there also needs to be some, not waste, but some slack that can be utilized, because in a complex system such as healthcare, you can't always predict what the needs will be at any given point. You must be able to monitor, adapt, react to whatever comes up to you. Another thing that has come out of the pandemic is, of course, the use of telehealth. It was driven by necessity. It was the only way we could provide care in many cases, so that's what we did. Now we need to find out how much of that we want to preserve. We hear that patients are not always so happy about video consultations. They want to come back, meet the doctor, the nurse face to face. But I'm sure that we will find that telehealth gives us new opportunities, in particular in the management of chronic diseases, chronic conditions, where I believe that the old-time system of coming to a clinic every 3 or 6 months or whatever, regardless of whether you actually have a problem at that time or not, will be replaced by something where we can use the tele opportunities, other kinds of e-health, because e-health is broader than just virtual communications. It's also the use of information technology to promote good care and even to use such things as electronic health records optimally. And there's a science growing up around that, which is something we need to take an interest in.
Yes, thank you, Dr. Carsten. I agree with you. It's important why you say the word is resilience, commitment. The people need to develop, and these. I say the pandemic started from day by night, and we need reorganize your process, reorganize your life in a short time. It was a big challenge, obviously, and the people around the world pass with a big challenge and stay learning until nowadays. Thank you. And Dr. Carsten, when I imagine this contest, if you could contextualize the current moment, not more in the past, but in the current moment, post-pandemic, in the health sector, what would you tell us about the actual moment in post-pandemic in the focus health sector? What do you say with us?
Well, I have mentioned a number of new challenges, new ideas that have been forced upon us. But of course, there are also some well-known challenges that may have been pushed a little aside during the pandemic, but they are there nevertheless. And some of the themes that are also important themes for us in ISQUA, in the information, the knowledge we want to spread. To mention three topics is sustainability. And here I talk both about environmental and financial sustainability. It's person-centeredness, which has been heavily challenged in a period where we had to isolate. And if we came close to the patient, we were wrapped into all kinds of PPE. And person-centeredness has a value in itself, but because it's core to the mission of what healthcare is about. But I think if we want to meet all the other challenges ahead of us, and just to mention another one is take our understanding of and our approach to patient safety to the next level, then we need to partner with patients. And what does that mean, and why is that? Well, first, when you, for instance, talk about the patient, it is true when you have a long and a long chronic experience with a lot of actors involved, but it's also true for someone who is in a highly specialized modern hospital today. We need to view patient safety as something that accumulates along the patient journey. Harm is not just the result of individual spectacular events. Often it accumulates through a series of misses, mistakes, small errors that one by one may not seem so important, but that add up to something that harms. We must take a realistic view on patient safety. We can do a lot by making best practices standard and by improving work systems and processes, but there are also situations where we can't standardize. For instance, taking care of a complex psychiatric patients with social problems in the home settings. We can't write a manual that just says, follow this and everything will be fine. We need, and the same is true for many other circumstances, we need to find ways of honing our opportunity to anticipate, monitor, respond, and learn the four code words for resilience. And back to the question of resource restraints, this also means that sometimes we have to make trade-offs. Trade-offs because we are restrained in some way, but in some cases also trade-offs because there are conflicting considerations. What is good for one disease in a multimorbid patient may be bad for another. And how do we meet this? How do we find the way through it? Well, now we come back to patient-centeredness and the question that, to me, encapsulates in sense of what patient-centeredness is, and that is asking the patient what matters to you. When we set our goals for the care we are giving, well, what other goals should we have than what matters to the patient? And often these goals will be well aligned with the goals of professionals, and for simple situations or where one disease is at play, it is straightforward most of the time. But when you come to complex multimorbid diseases, it may be less easy. So you need to ask the patient what matters to you. And when you need to make the trade-offs, you also have to involve the patient to determine what matters to you. But not only the patients, because we have professionals, we have patients, then we have managers and leaders, and we have policymakers. And all these four categories need to view each other as partners. And especially to the policymakers, one could say that sometimes some politicians seem to believe that you can change things just because you will, but just through your will. And there's a certain truth to that, but only a certain. Politicians also need to be realistic and to realize that we may be not able to give everything we would wish to give, but then it's up to all of us, policymakers, leaders, professionals, and patients, together to find out what is it that matters most and what will we do about it. And then we all must support and stand behind this decision. If we don't, then we create a situation where patients will be disconcerted and where staff will be victims to burnout and may resignate and leave healthcare. Because in my experience, staff are very dedicated, they are very conscientious, they want to do the right thing, and if they are not for some reason able to do it, they take it on themselves. And they shouldn't always, it's a good thing, of course, in a way, but it's also a danger because you need to have backup from your leaders and your policymakers to say, okay, this we have done the best that we were able to do, and we all agree on that, and it's our mutual decision that that's the way it should be.
Oh, Dr. Carsten, what you say is very, very important. We need, in fact, observe the journey of the patient, listen the patient, and the journey of a professional, and listen the profession and your word is very, very important. Thank you for your answer. Excellent, Dr. Carsten. And when we think about ISQUA, the expectative from the future, how is ISQUA preparing for it? What do you say for us about the preparing of ISQUA on focus on the future?
Well, ISQUA works under the tagline Knowledge Network Voice. So we are a kind of knowledge broker. And for us, it is important that we have a sense for know what it is for knowledge, what kind of knowledge is needed by those who are working in healthcare, and then try to find ways to provide it. We have a network of members, of experts, of academicians, and there is a lot of knowledge in this network. And the way we channel it out is through the journals, through the conferences, through our educational programs, the fellowship that you can sign up for. But actually, I would say that accreditation is also a way of spreading knowledge.
Yes.
Because what are the standards? They are little capsules of actionable knowledge.
Yes.
Standards are important because they can put something on the agenda. If something is important enough to stand in a standard that you are assessed against, then it is surely a signal that this is important, you should worry about this. Then you carry the knowledge with you within the standards, and by standardizing part of the process, you can reduce complexity by reducing the number of options in a given situation, by having sometimes I would like it to a good toolbox. You can't make a manual that tells you exactly what and how to use the tools in a given situations, but with a good toolbox, you have a good starting point for making your decisions in the individual situations. And much of what we're doing is relatively straightforward. We should make that as automated as we can in order to save our resources for those questions, issues, cases that are really complicated.
Yes, excellent. That sounds a great idea and very, very important. Is to promote and provoke the moments on the people have opportunity to change your experiences, your vivence, and collaboration, co-production. And ISQUA has an excellent programs. If you the expector that stay listen us today don't know know more about ISQUA and your programs because you have a big opportunities to change your experience around the world. It's very, very important. Thank you, Dr. Karsten. And the last one question is, if you, or Dr. Karsten, give a type or advice for health professionals in the healthcare, taking into account the post-pandemic context, what do you say about the professionals that stay listening us today?
Well, what would I say? Even as much as we may want to return to normal, don't assume that we will or should return to the state before the pandemic. We should learn from it. We are actually now, when we are emerging from a crisis, we are at a window of opportunity. So embrace the ideas of person-centeredness. Patient empowerment will change your role, but it will not mean that the patient's rule, we are talking about co-production. That's important. And also embrace systems thinking, as we have been talking about. You should realize that as professionals, you have an enormous influence, and you should use it to put your fingerprint on the future we're shaping. And I must say that all too often, I have seen professionals trying to keep things as they are, or even trying to push them back to a past that were perceived as being better. And much of the time, this has been in vain. Instead, go on, move forward, take the lead. You have a lot of good ideas, and these good ideas are needed. And try as much as you can to ally yourself, build partnership with patients, managers, and policymakers instead of wasting the time by fighting battles.
Excellent, Dr. Karsten. Excellent ideas and devices or tips for the people that stay listening us today. So unfortunately, I need to finish the interview. Congratulations for your explanations. I'm sure that the audience today that hears with loved the interview and reflect about all the things that you say. Thank you so much, Dr. Karsten, for this moment, for dividing your experience, for sharing with us your vivence and your ideas. Thank you so much.
You're welcome. It has been a great experience for me as well to talk to you.
Thank you. Bye-bye. Excelente entrevista com o Dr. Karsten Angel, da ISQUA. Foi muito bacana ter conversado com ele. Quantas dicas interessantes que ele nos trouxe, né, gente? Se nós pararmos para pensar a importância de nós ouvirmos aí o paciente em toda a sua trajetória, a liderança, os nossos colegas de trabalho, e tentar, a partir da experiência, né, de todos os que fazem parte do setor saúde, das organizações de saúde, melhorarmos os processos. Então, excelentes dicas, foi muito bacana, trazendo a realidade aí, né, de onde o Dr. Karsten vive, em Dublin, mas também trazendo aí o olhar da ISQUA, o quanto que a ISQUA tem realizado aí programas e estratégias para dividir experiências ao longo, né, aí por esse mundo que tem tanta experiência bacana que a gente pode compartilhar. Então, muito bacana, queremos agradecer imensamente ao Dr. Karsten Angel pela entrevista, pela excelente entrevista, pelos excelentes conselhos e dicas que ele nos deixou no dia de hoje. Muito obrigada mais uma vez, espero que vocês tenham gostado das dicas e dos conselhos do Dr. Karsten. Silvia, por gentileza, te chamo aí para dar sequência.
Obrigada, Giovanni, realmente excelente, viu? Obrigada a você também. Obrigada, Dr. Karsten. Bom, antes de continuar, eu quero fazer um convite, tá? Para vocês conhecerem um projeto social muito bacana da Hospitalar em parceria com Horas da Vida.
Todos conhecemos a dificuldade de acesso à saúde em comunidades periféricas. Por isso, a Hospitalar e o Instituto Horas da Vida criaram o projeto Doe Saúde, para atender e melhorar esse acesso em comunidades carentes. Você pode fazer parte disso e salvar vidas, doando horas de atendimento se tiver CRM ativo ou doando recursos financeiros. A partir de R$ 60, você garante a consulta a uma pessoa que precisa. Sua ajuda vale muito. Ajude-nos a alcançar nossa meta. Para saber mais ou doar, é só entrar no site da Hospitalar. Participe, salve vidas, faça a diferença.
legal, né? Muito bom. Que tal fazer uma boa ação hoje? Olha, estamos chegando ao final do segundo dia do aquecimento hospitalar, mas ainda tem mais conteúdo, tá? Vamos participar então do debate sobre os sistemas nacionais de saúde a partir de 2022, a inovação e os caminhos a seguir? Vamos lá? Então, para isso, eu gostaria que você me encontrasse na próxima sala, tá bom? Sai dessa sala aqui e clica nesse conteúdo aí na sua agenda. Te vejo logo mais.